I'm pleased to be joined today on Health Beat by Dr. Jared Rickert, an orthopedic surgeon with Faith Regional Physician Services, Orthopedics in Norfolk. And we're talking about hip replacement. So Dr. Rickert, tell us more about hip replacement.
I'd be happy to. And to show you, in addition to my animation back here, so a hip replacement is when you replace the ball and socket of the hip, and it's usually indicated for arthritis. Hip replacement is one of the most common procedures that an orthopedist performs. There's more than 300,000 performed each year, and there is a high success rate with greater than 90 to 95% success in terms of pain and function. Now, there are various approaches to do a total hip replacement. One of the ones I perform is posterior, and the other I perform is anterior. So with a posterior approach, you're splitting the gluteus maximus, or the butt muscle, some may refer to it as. So recovery takes a little bit longer, but by 1 year, anterior and posterior have equivalent outcomes. So the other approach I do is anterior. So the anterior approach, as depicted in the picture behind us, demonstrates the interval that goes between muscles rather than through. So by avoiding damage to muscle, you have less pain, quicker recovery, and you're getting off your walking aid sooner. Along with the anterior approach, it avoids, I wouldn't say a common complication, but a unique complication to posterior approach, which is dislocation. So it can help avoid that. So there's really been a renewed interest in anterior approach because of the better instrumentation and implants available.
And so things are just getting better all the time for that.
Yes, sir.
Terrific. Well, thank you so much.
You're welcome.
To learn more about clinic locations, specialties, and providers, visit frpsclinics.org.